the reporters.
Troy. Excuse me.
Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are again joining us virtually to adhere to social distancing guidelines. And we'll begin our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Thank you, Mike, and good afternoon to everyone. As we approach the start of the school year, the city, school district, and community partners are working together to support families with their digital learning needs. Earlier this month, we announced PHL Connected, a free in-home internet access program to address one of the biggest barriers to online learning. In addition, we know that families are facing larger challenges, particularly those who can't stay home with their children or do not have the other child care options. That is why we are setting up access centers throughout the city for our most vulnerable kindergarten through 6th grade students to rely on this fall. These access centers will provide internet access and a safe environment for digital learning during school days. The first phase of access centers will serve 800 students at 31 locations, with more centers being planned as we speak. These centers will be located at rec centers, libraries, and Philadelphia Housing Authority sites, and will begin operating on Tuesday, September 8th. Students will be able to sign into their virtual classroom and take part in the school's classes over a dependable internet connection. We want to be clear, access centers are not drop-off centers, nor are they a replacement for schools. Families will have to register and receive confirmation before they can bring their student to an access center. And in order to serve families with the greatest need, we are prioritizing students whose caregivers must work outside of the home and cannot afford or access another childcare solution. We will share more details about the access centers, including how to register, next week. And by the way, caregivers who can stay home to supervise their child but still need internet access for digital learning should seek out a different program that we announced earlier, PHL Connected. Families interested in PHL Connected should contact their school and be sure to update their contact information. And we'll also have more details on that next week, so stay tuned. We know many residents have been eagerly waiting for the day when indoor dining can return to Philadelphia. We certainly know that restaurant operators and their employees have been waiting as well. I'm pleased to announce that indoor dining will return on September 8th, the day after Labor Day. This will come with a number of restrictions that either match or exceed the restrictions now in place for indoor dining in the rest of the state. Dr. Farley and his team have spent many hours over the past few weeks evaluating the situation and devising restrictions that are appropriate for the city. I appreciate their work and their judgment. And I certainly appreciate the patience that owners, employees, and patrons have shown over the past 5 months. I know it hasn't been easy. The economic impact on workers, on restaurant owners, and on the city as a whole has been tremendous. So I hope this change on September 8th marks a turning point in our recovery and that everyone follows the restrictions so that this is only the beginning of a larger recovery for restaurants as the city and the city as a whole. I would urge restaurant owners, employees, patrons, let's not push the envelope. Let's follow the rules as we've been following the rules for quite some time now. And actually those rules have made us safer and have gotten us to this point. And we really need not to push it. We need to follow what we're being asked to by the health department. And as we've seen in the past, when we do that, the infection counts go down, the death counts go down. We start to open up more and more things and get ourselves back to a somewhat new normal. So please, I beg you to follow the rules. Now I turn it over to Dr. Farley, who has more details.
Thank you very much, Mayor. I have better news to report today. We are seeing a decrease in our case counts and in our percent positive. I'm going to talk about that, and then I'm going to discuss our reopening plans. Here are the numbers. Since this time yesterday, we've identified 105 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 32,674. Now that 105 represents 3.0% of the more than 3,400 test results that we received since yesterday. And that 3% is lower than the percentage we've seen before, and that's good news. Now, the new cases we're seeing still tend to be younger. More than 50% of those are under the age of 40. Since this time yesterday, we've identified no additional deaths from the coronavirus infection. Our total is 1,735 since the beginning of the epidemic. Now, we'll have to say that sadly, yesterday we learned of 18 deaths from the coronavirus infection in Philadelphia residents, which had occurred over the previous 2 weeks. It often takes us some period of time to identify the deaths. And from the mid-July to mid-August, we did see what looked like a small increase in the number of deaths that occurred, from about 8 per week to about 13 per week over the last few weeks. That increase, I think, is probably a delayed effect of the increase in cases that we saw occurring in late July. And we're hoping that as the case count is coming down now, that we will see the death count coming down in the future as well. That's what's happening in Philadelphia and the state as a whole. We've seen falling case counts in the past few days. In the United States as a whole, we're seeing case counts that are still high, but that are continuing to fall. Now, back here in Philadelphia, I want to give you an update on where we are with contact tracing. We are continuing to make progress on that. So here's data from last week, 7 days that ended Saturday, August 15th. There were 791 cases that occurred that time that were referred to the contact tracing team. 45 of those were managed by our partner organizations. Of the remaining 749, we reached 69% who then agreed to participate. That's a higher percentage than we've hit before. 4% we were not able to reach because we didn't have a phone, but that percentage is lower than before. 20% we were unable to reach because people didn't pick up the phone. And that's too high, but that's lower than we were before. In the past, it's been about a third. And 4% of people simply refused to cooperate. Of the contacts that those people named when we had those interviews, we reached 79% who then agreed to quarantine. And that's a higher number than we've seen before. So all those numbers are better than we were at before. Now, contact tracing helps us prevent the spread in individual people. It also gives us information about where the epidemic is overall. So here's what we're learning from that process, that most people who know where their infection came from identified it having come from another household member, or then a relative, or social gatherings, including small social gatherings just between relatives and a few friends, or travel, including people that were driving with others without wearing masks. And I do want to point out that when you're driving with someone, you're close by, not a lot of ventilation, and if you're not wearing masks, that is a high-risk situation. So there's a lesson in all that, and that is that the people you trust the most, your relatives and your close friends, are also the ones you're most likely to catch this infection from. Now, you should trust your relatives and you should trust your close friends in general, but not with COVID. They're just as likely to be infected as anybody else. So the message is wear a mask when you're around your relatives and around your friends, including those people you trust. Now, let me give you the update then on reopening. Back in June, we laid out 9 different metrics and targets to track our progress to determine whether it was safe for us to go to green, as the governor laid out the colors initially. We had hoped to meet all of those targets by early July. And turns out we met many of those, but we didn't meet all of them. The most important targets that we did not meet at that time was first the case rate. We said it should be fewer than 80 cases per day, or the percent positive being fewer than 4% if we were testing more people, more than 2,000 per day. Second metric that we didn't meet was we wanted to have a declining trend in our case rates over a 4-week period. And the third was we said within contact tracing, we wanted to be interviewing 70% of the cases. Now, because we didn't meet all of our targets, we went to a modified restricted green in early July. We did not allow some activities that were permitted by the governor. In particular, we did not allow indoor dining at restaurants. We did not allow indoor theaters, and we did not allow outdoor gatherings of more than 50 people. So since then, we have made progress, and we're getting very close to the remaining targets. The percent positive last week was at exactly 4.0%, just at the target we wanted to meet. And the trend in the percent positive has been declining. Starting the week of July 19th, these are the percent positives in those 4 weeks: 5.4%, and 4.8%, and 4.1%, and 4.0%. In contact tracing, where our target was to interview 70% of the cases, as I just mentioned, Last week, we reached 69% of the cases. So we're very, very close. So in hopes that we will have continued progress over the next 2 weeks, we will allow more activities that are permitted by the Commonwealth to restart with restrictions that are similar to those for Pennsylvania as a whole. Now, all this is assuming that there's no significant reversal in the percent positive in the next 2 weeks. We will do this reopening very carefully. And I repeat that, we will do this opening very carefully. It's effective September 8th, the day after Labor Day, and that's to avoid holiday crowds. We don't want to start out with a large number of people in one place in a very high-risk situation. We will retain some restrictions on how things are done. So we will allow indoor theaters to have up to 25 persons. That's what is allowed by the Commonwealth. In there, people will need to wear masks. People must wear masks. And because people must wear masks, no food or drink will be allowed in those indoor theaters. We'll be posting more detailed guidance on theaters either later today or tomorrow. Then indoor dining at restaurants. Because people cannot wear masks while they're eating or drinking, we have to have other restrictions for safety. So the restaurants will have to meet no more than 25% of their capacity. That's consistent with the state regulations. The tables need to be spaced, so the diners are at least 6 feet apart from people at other tables. That's also the same rule as with the state. The tables will have to have 4 or fewer seats. And that's to emphasize that this is about people eating with members of their household. We don't want to have a large number of people at a table together from other households. When we have mixing of households where people are not wearing masks and they're close together, that's a high-risk situation. There will be no seating at bars. It's only going to be seating at tables, and no alcohol served except during a meal. These are the state rules, which we also strongly endorse because we know that bars are even higher risk settings than restaurants. So we're allowing restaurants, we are not allowing bars to reopen. The servers must wear face masks and face shields because the servers are the people who are at greatest risk. They're the ones who are going to be coming in proximity to many people over the course of a day who won't be wearing masks. We'll also be encouraging restaurant owners to improve the ventilation in their facilities, such as opening windows and doors or optimizing the settings in their HVAC system. Now, we're asking restaurant managers to take these restrictions very seriously and follow them. That's for the sake of your staff, for the sake of yourself, as well as for the sake of your customers. But in addition to that, we will be enforcing these regulations as much as we can. We'll be sending staff and perhaps volunteers into restaurants to educate restaurant managers about exactly what they need to do. In addition, we'll be sending restaurant inspectors to conduct inspections and looking at these key safety precautions. They'll be doing that proactively, and they'll be doing that in response to complaints. If they find that diners are crowded together or the staff are not wearing masks and not wearing face shields, we will be quick to close restaurants. Now, also, we're asking restaurant owners to promote the exposure notification app that the state announced just the other day. What this app does to remind people is it sends a message to phones that were close by if a person tests positive and then authorizes that notification. There's no names that are passed back and forth, but then people whose phones were close to the phone of someone who was positive will get a message that says that they might have been exposed to COVID and they should take precautions. That app is not available yet, but it's scheduled to be available in early September. And it'll assist us in contact tracing if a case is found on someone who had eaten at a restaurant. So those are the things we're allowing to reopen. For now, indoor gatherings are still capped at 25 persons, and outdoor gatherings are still capped at 50 persons. Now, across all that, I hope you see that there's a key theme here, and that is that our masks are our most important line of defense. If mask use is enforced in a setting, it's much more likely that activities will be safe, and it's much more activity, therefore, we will allow to occur. We need to limit the settings where people are congregating and they're not wearing masks. In the few circumstances where masks can't be worn, like restaurants, we have many other restrictions. So that's the reopening plan, but now we may reverse course if, after reopening, we find that many people are ignoring the safety standards. Or after reopening, we see that there are repeated incidents of spread at restaurants or theaters. Or if we see a substantial increase in the percent of people who test positive, either before September 8th or after September 8th. I also need to put everyone in Philadelphia on notice now that most respiratory viruses, from influenza to cold viruses, tend to get worse in the late fall and winter. Our flu season peaks typically in January and February, but it starts earlier than that. I want to put everyone on notice that we may have more restrictions in the future if our case rates start to rise as the seasons change and the virus starts to behave differently. And to individuals, let me just remind everyone again, there's nothing more important than wearing a mask. It's not hard to do. If you do it when you're around other people, you're going to protect yourself as well as others. And then remind people who are vulnerable medically about this virus. If you're over age 65, or if you have chronic medical conditions, you are at risk, best to stay home and avoid contact with other people who are out and about unless you're wearing a mask, unless they're wearing a mask. Thanks very much. If you want more information, go to our website, www.phila.gov/COVID.
Thank you, Dr. Farley. We are going to move in just one moment to Armando, but first I want to just remind folks, since we already have a large number of reporters with their hands raised, that this press briefing is primarily on topics related to COVID-19. Now that would include the just announced changes that Dr. Farley and the mayor announced concerning indoor dining, as well as on the announcement regarding access centers. If you have questions on any other topics, please hold them until the second round of questions. If your hand is raised now and your question is not on COVID or the access centers, please lower it and we will announce the second round when we get to it. Thank you. And now to Armando for the Spanish language translation.
Palabras del alcalde Jim Kenney para el jueves 20 de agosto del 2020. A medida que se acerca el inicio de clases, el distrito escolar, la ciudad y nuestros socios comunitarios están trabajando juntos para apoyar a las familias en su transición al aprendizaje digital o en línea. A principios de este mes, anunciamos PHL Connected, un programa gratuito de acceso a Internet desde el hogar para abordar una de las mayores barreras para el aprendizaje en línea, la conexión a la Internet. Porque sabemos que algunas familias enfrentan desafíos mayores, en particular aquellas que no pueden quedarse en casa con sus hijos o que no tienen otras opciones para el cuidado infantil. Por ello, estamos estableciendo centros de acceso en toda la ciudad para que nuestros estudiantes más vulnerables, desde el jardín de infantes al sexto grado, puedan comenzar sus clases este otoño de una manera segura. Los centros de acceso les darán conexión a Internet y un entorno seguro para el aprendizaje digital durante los días de clase. La primera fase de los centros de acceso atenderá a 800 estudiantes en 31 ubicaciones y planeamos abrir centros adicionales también. Estos centros se van a instalar en los centros de recreación, bibliotecas y locales de la Autoridad de Vivienda de Filadelfia y comenzarán a operar el martes 8 de septiembre. Los estudiantes podrán iniciar sesión en su aula virtual y participar en las clases de la escuela a través de una conexión a Internet confiable. Queremos quedar claro, los centros de acceso no son guarderías, tampoco son un reemplazo para las escuelas. Las familias deberán registrarse y recibir confirmación antes de que puedan llevar a sus estudiantes a un centro de acceso. Y para atender a las familias con mayores necesidades, les daremos prioridad a los estudiantes cuyos padres o representantes deben trabajar fuera de casa y no pueden pagar o resolver de otra manera sus necesidades de cuidado infantil. Compartiremos más detalles sobre los centros de acceso, incluyendo cómo registrarse la próxima semana. Y por cierto, los padres o representantes que sí pueden quedarse en casa para supervisar a sus hijos, pero que aún necesitan acceso a Internet para el aprendizaje digital, deben registrarse en el programa PHL Connected. Las familias interesadas en PHL Connected tienen que comunicarse con su escuela y actualizar su información de contacto. La próxima semana les tendremos más detalles, así que estén atentos. Sabemos que muchos residentes han estado esperando con ansias el día en que Filadelfia pueda volver a tener un servicio en el interior de los restaurantes. Ciertamente, sabemos que los operadores de restaurantes y sus empleados también lo han estado esperando. Me complace anunciar que los restaurantes podrán volver a ofrecer servicio en interiores a partir del día 8 de septiembre, el día después del Día del Trabajo. Esto vendrá con una serie de restricciones que igualarán o excederán las restricciones vigentes para comer en interiores que hay ahora en el resto del estado. El Dr. Farley y su equipo han pasado muchas horas durante las últimas semanas evaluando la situación e ideando restricciones que son apropiadas para nuestra ciudad. Aprecio su trabajo y su buen juicio. Y ciertamente agradezco la paciencia que los propietarios de restaurantes y sus clientes han demostrado durante los últimos 5 meses. Sé que no ha sido fácil. El impacto económico para los trabajadores, para los dueños de restaurantes y para la ciudad en su conjunto ha sido tremendo. Así que espero que este cambio del 8 de septiembre marque un punto de quiebre para nuestra recuperación y que todos respeten las restricciones, para que esto sea solo el comienzo de una recuperación mayor para los restaurantes y para la ciudad en su conjunto. Y esta es la actualización en materia de salud para el día jueves 20 de agosto del 2020. Comenzamos con buenas noticias. Hay una disminución de los casos y en el porcentaje de casos positivos. El día de hoy reportamos 105 nuevos casos con un total de 32.647 casos acumulados. Los nuevos casos se presentan en grupos más jóvenes, el 50% entre los menores de 40 años. Hoy, felizmente, no reportamos fallecimientos por la COVID-19 en la ciudad. El total acumulado de muertes por la COVID-19 es de 1.735. Ayer reportamos 18 nuevos casos y ha habido un aumento de muertes semanales. Pasamos de 8 muertes semanales a mediados de julio a 13 semanales ahora. Probablemente esto se deba a un efecto retrasado del aumento de los casos en el mes de julio. En Pensilvania, los casos están disminuyendo en los últimos días y en los Estados Unidos, los casos siguen altos, pero continúan disminuyendo. Respecto al reporte del rastreo de contactos, los datos de la última semana, es decir, los últimos 7 días hasta el sábado 15 de agosto, muestran que hubo 791 casos y 45 de ellos fueron gestionados por nuestros aliados. De los 749 restantes, el 69% acordó participar en el programa. El 4% no tiene el teléfono de sus contactos. El 20% no pudo ser contactado. Un 4% se negó a informar sobre sus contactos y un 3% no sabía de qué se trataba el programa. De los contactos nombrados, el 79% fue contactado y estuvieron de acuerdo con cumplir con la cuarentena. ¿Qué es lo que hemos aprendido de las entrevistas sobre la propagación del virus? Que el virus lo propagan los miembros de su hogar, lo propagan familiares, que se contrae en reuniones sociales, así sean pequeñas, que se da por medio de los viajes, incluyendo el contacto con otras personas que no llevan puestas máscaras. ¿Qué son las lecciones que hemos aprendido? Las personas en las que uno más confía son aquellas en las que es probable que le den la infección a uno. Se debe confiar en ellos, en general, pero no durante esta época de la COVID-19. Por favor, use una mascarilla cuando esté cerca de familiares y amigos. Y ahora vamos a hablar de algunas nuevas etapas en el proceso de reapertura. En junio, establecimos 9 medidas para rastrear el progreso y los objetivos para poder pasar a la fase verde. Esperábamos cumplirlos todos a principios de julio, y cumplimos muchos, pero no todos. No se cumplieron los objetivos más importantes, que es tener una tasa menor a los 80 casos por día o un porcentaje positivo por debajo del 4% de 2.000 pruebas diariamente. La tendencia estable en la tasa de casos en descenso durante las 4 semanas. El seguimiento de contactos era de alcanzar el 70% de los casos. En consecuencia, pudimos pasar a un programa verde modificado y restringido. No se reanudaron algunas actividades permitidas por el gobernador, en particular el servicio en el interior de restaurantes, y no se pudieron abrir los cines o teatros bajo techo. Las reuniones al aire libre se permitieron con un máximo de 50 personas. Desde entonces, hemos avanzado acercándonos mucho más a los objetivos que nos quedaban. Hemos alcanzado el 4% de casos positivos la semana pasada. La tendencia en los porcentajes positivos es decreciente. Comenzando a partir del 19 de julio, la tasa de porcentajes positivos ha pasado del 5,4% al 4,8%, luego al 4,1% y finalmente hemos llegado ya al 4%. En cuanto al seguimiento de contactos, se alcanzó el 69% de los casos la semana pasada. Tenemos la esperanza de un progreso continuo en las próximas 2 semanas. Esto permitirá que se reinicien más actividades permitidas por la mancomunidad con restricciones similares a las que tiene el estado de Pensilvania. Suponiendo que no se revierta significativamente el porcentaje de casos positivos en las próximas 2 semanas, haremos esto con mucho cuidado. Hoy anunciamos que a partir del martes 8 de septiembre, el día después del Día del Trabajo, para evitar aglomeraciones en los días festivos, Los restaurantes pueden comenzar a ofrecer servicio en sus interiores en los establecimientos que sirvan comida. Mantendremos algunas restricciones sobre cómo se realizará esa actividad. Se permitirá igualmente la apertura de teatros bajo techo con hasta 25 personas y menos del 50% de su capacidad, y recordándoles que las personas deben usar máscaras y no se permitirá ni comida ni bebida en los teatros o cines. Vamos a publicar una guía más detallada el día viernes o el lunes siguiente. Respecto al servicio en el interior de restaurantes, debido a que las personas no pueden usar máscaras mientras comen o beben, habrá otras restricciones. Los restaurantes pueden abrir con menos del 25% de capacidad, de acuerdo con las regulaciones estatales. Las mesas deben estar espaciadas para que los comensales estén separados por más de 6 pies. Las mesas deben tener un máximo de 4 comensales. No está permitida la operación de los bares. No se sirve alcohol excepto durante la comida. Estas son reglas estatales que nosotros en Filadelfia respaldamos firmemente, porque los bares son entornos de mayor riesgo que los restaurantes. Los meseros deberán usar máscaras y protectores faciales. Los meseros son las personas que enfrentan uno de los mayores riesgos de contagio. Animamos a los restaurantes a mejorar su ventilación, abriendo ventanas, puertas u optimizando sus sistemas de ventilación. Les pedimos a los gerentes de restaurantes que tomen en serio las restricciones y las observen, por su personal y por ellos mismos. La ciudad hará cumplir estas regulaciones. El personal del Departamento de Salud y quizás los voluntarios visitarán los establecimientos para educarlos. Los inspectores de restaurantes realizarán inspecciones de forma proactiva y en respuesta a las quejas que se reciban. Si las mesas no se mantienen a una distancia de 6 pies o el personal no usa máscaras ni protectores faciales, cerraremos rápidamente esos restaurantes. Además, les pediremos a los propietarios de restaurantes que promocionen la aplicación de notificación de exposición al COVID-19 entre sus clientes. Esta aplicación envía un mensaje de texto a los teléfonos que estaban cerca de esa ubicación si una persona resulta positiva en la prueba y autoriza la notificación. Esto estará disponible a principios de septiembre. Las reuniones en interiores todavía quedan limitadas a 25 personas y al aire libre a 50 personas por ahora. Los mensajes clave en este proceso son: el uso de la máscara constituye la línea de defensa más importante contra el virus. Si se usan mascarillas, se puede realizar muchas más actividades de manera segura. Usted debe limitar los lugares donde las personas se congregan sin máscaras. En algunas circunstancias en las que no se puedan usar máscaras, como en los restaurantes, hay muchas otras restricciones. Este es nuestro plan de reapertura, pero pudiera revertirse si es que, después de reabrir, muchas personas ignoran las pautas de seguridad, o después de reabrir vemos incidentes repetidos de propagación del COVID-19 en restaurantes o teatros, o si vemos un aumento sustancial en el porcentaje de casos positivos antes o después del día 8 de septiembre. Es importante destacar que la mayoría de los virus respiratorios empeoran a finales de otoño y durante el invierno. Les informamos a todos que pueden haber más restricciones si es que la tasa de casos comienza a aumentar. Un recordatorio para todas las personas. Por favor, utilicen su máscara, mascarilla o tapabocas continuamente. Esto es más importante que nunca. El COVID-19 representa un riesgo para las poblaciones vulnerables. Si usted es mayor de 65 años de edad o tiene condiciones médicas crónicas, usted está en riesgo. Por favor, quédese en casa. Evite el contacto con familiares o cuidadores que estén pasando tiempo fuera de casa. Tanto usted como ellos deben usar la mascarilla cuando estén cerca. Recordemos que solo juntos y nosotros podemos vencer el COVID-19 usando nuestras máscaras. Así es que póngaselas. Muchas gracias.
Okay, thank you, Armando. We're now going to move to the Q&A portion for members of the media. And thank you again for joining this briefing on topics related to the COVID-19 pandemic. Joining us today, in addition to the mayor and health commissioner, our first deputy managing director, Tumar Alexander, as well as Cynthia Figueroa, who is deputy mayor for the Office of Children and Families, and Mark Wheeler, who is chief information officer, the Office of Innovation and Technology. Both Cynthia and Mark are here and able to answer any questions related to the access centers we just announced that provide supervised spaces for children during digital learning this fall. Only one representative from each media outlet is permitted during the first round. And because of the very limited time today, we have a hard stop at 2 p.m. We are going to ask reporters today to limit their questions to 2 or fewer, and then we'll get to a second round if we have time. Let's start off today with Shaira Arias of Telemundo.
Hi, Mike. Thank you. Okay, tengo una pregunta, Armando, sobre el centro de los niños donde ellos pueden ir. Para estos niños y los padres que no tienen transportación, ¿la ciudad planea proveerle a ellos algún tipo de transportación, autobuses, para que ellos puedan dirigirse a estos centros que van a estar abiertos para ellos?
Voy a contestar para Armando, Shaira, que no tenemos servicio de transporte. Los centros están cerca de sitios de la comunidad. En este momento no tenemos. Espera que la familia pueda traer los niños a los centros. So we just asked if there was going to be transportation available for the centers, and the city is not available to provide transportation, and our intent is to make sure that families can bring their children to the center.
Shaira, did you have another question on that?
Not on that, but this one is related to the restaurants.
Sure.
So, Armando,
Armando can.
sí.
Yes. Adelante, Shaira.
Okay, déjame ver, ¿qué pasaría si el 8 de septiembre hay más cosas y lo atrasan otra vez? Y ya los restaurantes invirtieron, empleados, comida, etcétera, y de tal manera se prepararon para que oficialmente puedan abrir el 8 de septiembre. Y en dado caso, obviamente, podría eso cambiar, de que tenga que cambiar la apertura del 8 de septiembre.
The question is probably for Dr. Farley. What would happen if after September the 8th, there's an increase in cases and the restaurants have to be delayed in their opening, or there are further restrictions after they've invested money in foodstuffs and their employees are willing and ready to go back to work?
We recognize this is really difficult for restaurateurs because there's so much uncertainty. We would hope that the case counts will go down and stay down, but at some point, if they start to go up, we will have to go back and close restaurants. And we will do that very reluctantly, but if we need to do that for controlling the epidemic, we will do that.
Esta es una pregunta muy difícil de responder, y especialmente para los operadores de restaurantes. Nosotros tenemos la expectativa y la esperanza de que los casos disminuyan, pero en caso de que los casos vuelvan a subir, desgraciadamente vamos a tener que cerrar los restaurantes y ver cómo proceder, porque queremos mantener bajo control esta pandemia.
And Mike, just to be clear, just to address the elephant in the room, any questions related to the encampment? Do we have to wait till the second round since we're waiting on the judge?
That is somewhat COVID related, but we are trying to limit to 2 questions for the first round because of the large number of reporters with their hands raised. So if you don't mind circling back on that, we will certainly try to get to you on that. Okay. Let's go now to Victor Fiorello of Philadelphia Magazine.
Good afternoon. I have 2 questions for Dr. Farley. In reference to the theater reopenings, are we talking about movie theaters and performing arts venues there?
Correct.
Both of those. And did you say, and I wasn't sure if I heard you correctly, did you say 25 or fewer people or 25% capacity? And if it's the number of people, how does that make sense as opposed to just doing a percentage of occupancy?
So it's actually falling in line with the state's regulations on this. And the state's regulations, I'm fairly certain, we may need to triple check, is that you have to be below 50% capacity and fewer than 25 persons. So even if you have a giant auditorium, you can put no more than 25 persons inside.
Got it. And my other question for you, Dr. Farley, relates to the restaurant inspections that you mentioned. Are there any plans to step up inspection efforts, just as somebody who sort of regularly goes through the list of inspections and also is out in the city a lot? I've talked to you before about sort of flagrant violations. Given that we're reopening, which could create a more dangerous scenario, do you expect to actually have more inspectors or have more inspectors, have inspectors visiting restaurants more often?
Well, we only have so many inspectors, and we don't know how many restaurants will choose to do indoor dining, but it may be in the thousands. So there's going to be limits to how many we can do. However, what we will be doing is recruiting additional staff that will be going and educating restaurants about what they need to do. And if they spot anything that it does appear to be out of line or inappropriate, then they can pass that information on to an inspector who can then go and do a complaint-based inspection for that restaurant.
Great. Thank you for your time.
Thank you, Victor. And let's go now to Charlene Santiago of Univision. And I should have explained earlier, Cynthia Figueroa, Deputy Mayor, is obviously, as we figured out by now, fluent in Spanish. So Charlene, if your question is about the access centers, Cynthia can answer directly.
Yes, perfect. Thank you. Mi pregunta para Cintia es si en estos centros habrá personal adiestrado para apoyar a los estudiantes de educación especial.
Pues los centros no son escuelas, o no vamos a tener maestras adentro de los centros y vamos a trabajar cerca del distrito escolar si hay necesidad especial para los estudiantes. So the question was, are there going to be personnel that are prepared to support any special education needs of the children? And I've just repeated, my answer was that the centers are not schools, and so that we are not providing any special instruction. There's no teachers physically that are staffing those sites, and that any specific needs that children have, we would be working in partnership with the school district to address those needs.
Listo, gracias. Y mi segunda pregunta es para el doctor Farley. Dado que ha habido mucho temor cuando se iba a reabrir las escuelas, ¿qué garantía le da desde una perspectiva de salud a aquellos padres que sí necesitan de este servicio, pero pueden tener dudas si enviar a sus hijos o no?
Question is for Dr. Farley. Given the fear that many people have had about the reopening of school, what guarantees can you extend to parents who do need to send their kids to school so that there are no doubts about it?
I can simply say that we have worked closely with the different school systems to have them be as safe as possible. As safe as possible does not mean that there's no risk to having the infection. You can have risk of the infection going anywhere, and even staying home. There's some risk for some people who are going out, and as you learn, the greatest risk is exposure to your relatives. But I can say that we have worked with all the school systems that are having any in-person instruction to have every precaution that we could consider be put in place. And we'll continue that conversation with them. And if it turns out that we're seeing more transmission than we find acceptable, we'll change.
La respuesta es que nosotros estamos trabajando con las escuelas y los sistemas escolares para que operen de la manera más segura posible. Y no es posible que no haya ningún riesgo en ningún lugar. Como hemos visto, uno de los mayores lugares de riesgo es el hogar, cuando no hay protección. Y el mayor riesgo puede darse a través de los parientes que están en el hogar sin protección. Por lo tanto, les estamos pidiendo a los sistemas escolares que ejerciten la mayor precaución posible y estamos teniendo una conversación con ellos. Obviamente, si vemos que hay un cambio y esto se da de una forma negativa, vamos a tener que hacer cambios nosotros también.
Okay, just to be clear, this does apply to the access centers, right?
Dr. Farley, does this apply to the access centers as well?
I'm not sure what you say this is. The access centers will certainly have precautions in place to minimize the risk of spread of COVID.
Con respecto a los centros de acceso escolar a la Internet, obviamente, ciertamente estos centros van a tener las precauciones instaladas para tratar de evitar la diseminación de este virus.
Thank you, Charlene. And let us go now to Jack Thompson of Metro.
Hello, this is about the access centers. I was wondering about the selection process. Will there be income requirements, and how will the city handle if more than 800 people register for those slots?
So as I'll start backwards, Jack, which is we're doing a phased approach. And part of that is really to track what we're seeing in terms of demand. What we don't want families to do is, if you already have current arrangements or have childcare that you have been utilizing, is to not pull your child from that arrangement, but continue that process. We've received good news that subsidies for school-age children is going to continue through the school year. So again, we're really trying to target those where they have absolutely no options available. So the registration process will ask questions about current arrangements and if there are no other arrangements. And then there will be a phase 2. So we're hoping to be able to get up to a larger number of sites based on what we track in demand that we get in the enrollment process.
Yeah, and do you have any idea on that demand yet, or are you not sure what the demand is for these sites?
We're not opening the enrollment process until next week. we wanted to make sure we announced and shared the locations of the sites in this current announcement. And then starting the week of August 24th, we'll have both telephone and online ability for families to register their children.
Okay, thank you.
Sure.
All right, thank you, Jack. Let's go now to Rudy Chinchilla of NBC 10.
Good afternoon, everybody. So my first question is actually going to be about coronavirus in colleges. So, you know, we've seen college students in other states, you know, become infected and schools have to close down. Are you guys concerned about college students returning, you know, from other states into the city and possibly be, you know, causing further COVID outbreaks? And are you guys, you know, looking at containment efforts, you know, plans to break up parties and the such?
We are definitely concerned about college students passing on that risk. Back in July, we foresaw that we would have a risk here. And so we worked with every college in the city to have them submit plans to us. We reviewed those plans. We gave them changes that they needed to make in those plans and continue that conversation. We addressed risk in a number of particularly risky settings within an overall college or university. There is one that is difficult for the colleges and universities to risk, and that is spontaneously planned social gatherings amongst the college students, whether they're on campus or off campus. We ask them to address them as much as they can, and the colleges all have efforts to do that. We're hoping that they can limit that, and the students will be responsible about that. We'll watch that. If we see a big problem with that, we'll see what other things might need to do to intervene.
So it sounds like it's going to be more up to the individual schools themselves to do that enforcement, right?
Correct. Now, I mean, if the students say they're all going to go to a bar to drink, they'll find they won't be able to do that because the bars are not open. So we do have these other prevention strategies in the community as a whole. But if the students decide to, you know, have a keg and a big party on campus, then it's the responsibility of the college to set some limits on that.
Okay. And then my other question is also about access centers. And Dr. Farley, I know you ran down through some of the, you know, what you guys are doing in terms of trying to make them as safe as possible. But I guess then if we are determining that access centers where they're still at the end of the day congregate settings are going to be available, why not, you know, just in-person instruction, in-person schooling?
You know, the health department said that schools could open in Philadelphia if they met certain safety standards that we put out there. And then the schools, some school systems in the city chose not to open because of concerns of primarily on the part of teachers. But we felt that they could be open with safety standards. So the parochial schools, for the most part, will open. The public schools are not. The charters in general will not. The independents may or may not. You know, and the standards we have for the access centers are very similar to the standards we have for schools.
Okay, and actually just to tack on that, just to clarify, the access centers will be open to students in the school district of Philadelphia, not like parochial schools and the such, or is it going to be just everybody in the?
I'm going to let Cynthia Ferraro answer that one.
Sure. Thank you, Dr. Farley. So we are taking anybody who finds themselves in a situation of requiring virtual access, digital access, as well as having a childcare issue. So it will not be determinate that it has to be district, charter, or parochial school. And I just want to add that the intent of the access centers isn't to cover the entire student body, because as we stated, these are not schools. So we're also able to limit the cohort numbers and the size of the gathering.
All right, thank you, Rudy. And let's go now to Dale Mezzacappa of Chalkbeat.
Hi, thanks. So people have already, I'm talking about the access centers as well. People already have talked a little bit about the limitations, but what about the ultimate capacity? Superintendent Height said this morning that, you know, there's maybe 40,000 kids in K-6 just in the district schools. A lot of them have needs. Do you have an idea about what your ultimate capacity is to do this? And could you also speak a little bit about, you know, the kinds of trainings that people, are they just going to be employees of either, you know, the housing authority or the rec center, the recreation department? Could you just give us a little more details about that?
Sure, Dale, there are a few different pieces to unpack there. So I'll start with the training first, and you might have to refresh my memory on the other questions. But the staffing is going to be supported by both city employees, both of the rec centers, some free library personnel, and then we're using providers who currently do out of school time and work on youth development. So all of those employees have all the required clearances to work with children. In terms of training, there'll be standard operating procedures for those sites, so they'll be trained on that. There'll be a refresher on mandated reporting of child abuse, as well as the ability to log on and understand the access process for the Google Classroom as it relates to the district. And I can't remember what the top of the question was, Dale.
It was the ultimate capacity. Do you think?
Yes.
Have you estimated the need and what the ultimate capacity would be to be able to do this? And just another, while I was wondering, that was related to the issue of, and maybe Mark Wheeler can answer this, about updating the how Phil Connect Ed is going, and what kind of progress is being made on getting more people connected.
So I can start and then hand it over to Mark around the need and capacity. We recognize there's various degrees of needs among the families. And in addition to the work that we're doing with the access centers, there is a huge number of community-based organizations that have reached out to us who are planning to operate similar programming. There's also a lot of faith-based institutions that are opening their congregations and their doors to support children. So we're really encouraging as much creativity, not just by the city, but by a lot of our partners. The number that Dr. Haidt, that possibly was referenced this morning, may have had to do, because that number sounds familiar as it relates to the gaps in digital access. We do know that targeting the younger category, that we were looking at a total number, but we know that not every single child has a childcare need. And the only thing I will share in terms of experience is both of our, all of our in-person after school programs and summer camp programs that were at a very much reduced level were underutilized. And so it was very difficult to track what the actual capacity need is going to be. And that's part of the reason we're in a position to continue to roll out in phases. So I can't answer, Dale, today what the total max capacity is. We're building that out. Our target is to get to at least 50 sites by the end of September. And if we have to add more sites, we're preparing those conversations as well. But Mark can give an update about where we are in terms of Philly Connected.
Sure. We're making really good progress towards being operational. We are working hard with our partners in the public school realm, the charters and the school district, and also having conversations with the independent mission schools as well. So the program will be open starting next week. We will plan to announce who our coordinating agent is and a hotline number. So people could stay tuned. I think the best thing still for families is to make sure that their information is currently up to date with their school, no matter what school that is, so that when the outreach is conducted by the city and by the different school agencies, they are reaching the right email, the correct telephone numbers and mailing addresses. And this will also help facilitate the connection to the internet services. If families are very concerned about not having access, and these are families who do not have internet at home right now, they can sign up for the 60-day promotional Internet Essentials program through Comcast. We are working through our agreement with Comcast to help move over and K through 12 families who are in that program. That's still a work in progress. We will have more details on that later, but we think it's worth families understanding that now, that if they are concerned, they can sign up for that free 60-day now to be ahead of the game for early September.
Thank you, Mark, and thank you, Dale. And again, as Mark said, we will have more on PHL Connected next week. Let's go now to Laura Crystal of the Inquirer.
Hi, everyone. First, a question on the access centers. How soon could a second phase realistically be rolled out if, say, you do get more initial interest than is space in the 800 slots? Like, would you be in a position to roll that out immediately, or would people be turned away for a bit?
So we anticipate that we would be able to move to that larger number by September 21st at the latest. There are some sites that could host additional cohorts, so we could even look at expansion within existing sites. So by the 21st would be the latest we would extend those additional sites.
Okay. And then I have a couple of questions about the indoor dining for Dr. Farley. We've had, there are some restaurant owners who have come out and said that they really wouldn't be comfortable opening indoor dining for quite a while, maybe until there's a vaccine or everything seems past us. Dr. Farley, do you think that that is, do you understand that approach, or would you say that it really is safe enough for restaurants to be opening and people to be going to them?
I completely understand restaurants' managers' concern. If you have a group of people together not wearing masks, there is clearly risk there. So some restaurant owners really want to open because they need to bring in, income and employ their staff. Other restaurant owners decide it's not worth the risk. That choice is up to them. We have just tried to say, if you want to open, these are the things you need to do to have it be as safe as possible.
Okay. And then my last question is what, in the case of an outbreak caused by a particular restaurant, what steps would the city take? Would that restaurant need to close if it involved like staff and customers getting infected, and how would it be handled?
If we thought that there was, I would imagine if there's an outbreak really associated with the restaurant, they're gonna have to close at least some minimum period of time, at least to have a good cleaning. It doesn't need to be a terribly long period of time. The more important thing is to notify those people who might have been exposed to that restaurant, which we would use a combination of methods to do, and that anybody who's been exposed needs to quarantine, and so the restaurant may need to continue to stay closed because they simply don't have any staff who can work.
All right, thank you, Laura. Let's go quickly now to Martin Pratt of Philly YBN.
Can you guys hear me?
Yep, go ahead.
Excellent, thank you. One quick question based on follow up to Victor's question. What penalties will restaurants and workplace be incurring if they do not comply?
Well, we have two tools at our disposal. One is fines and another is closure. We're more inclined to do closure, but we do also issue fines. And we regulate restaurants regularly. And so it's a whole mechanism for issuing fines and enforcing fines and doing closures. And if restaurants don't pay their fines, then if they're closed, they can't reopen.
And the second question is, this is more for the administration. Does the administration support workers' choice to strike if their employers are not adhering? So this could be a workplace environment situation, but they're not adhering to keeping their employees safe during COVID-19.
Well, I've always supported workers' rights to stand up for themselves and to organize and to strike if necessary. So it wouldn't be any different than I would look at any other sector of the economy and the workers that work in that sector, and they have workers' rights as everyone else does.
Okay, thank you.
All right, thank you, Martin. Let's go to Avi Wolfman Arendt of WHYY.
Yeah, hi, this is a quick question. For the access centers, has the union that represents rec center workers, have they signed on to this plan? Yeah, that's the question. Have they signed on to the plan that you guys have presented?
Cynthia, you're muted there.
Sorry about that, Ari. So we've been working closely with the union in discussion because of the activities being similar to some of the summer-related activities, and so we are working, positively towards that progress.
Avi, you good? You're muted still.
Yeah, I just wanted to follow up quickly. So they haven't said yes yet. You're talking with them, but they have not said like we'll do this.
I think we've been I mean, I don't want to speak on behalf of the union for sure, but we've been working on the particulars and making sure that any concerns that they have for their members are addressed. And certainly those are similar concerns that we would have to ensure both safety, making sure their roles. And I think why we've been very clear that these are not schools, and the expectations of being able to meet particular needs of children is not something that we would ask our members to do. And so I think everybody just wants to be entirely clear of all the expectations. And so I believe that we will get to a positive outcome, but I don't, nor can I speak for the union.
All right, thank you, Avi. Let's go to Natasha Brown of CBS3.
Hi, this question is for Cynthia, just in reference to the access centers. Just overall, I know you're still going to be gauging the capacity, the maximum capacity, and ultimately how many sites you'll need. But on any given day at these sites, how many children will be allowed to be there? I know that, overall, the city is talking about keeping indoor gatherings to 25 people. Will that be the same for these access centers?
So for the access centers, we are targeting cohorts of 25. There are 31 sites identified in the first round that serve 800 children. There are a few sites that can have more than one cohort, but those are very large sites where the children wouldn't have to share bathrooms, they wouldn't have to be in close proximity to each other. And so again, we've worked closely with the health department to ensure that we would not cap above a certain amount, just to make sure that we adhere to all the safety guidelines.
Okay, and one last question for you, Cynthia. Just overall, I know somebody asked you this earlier. I didn't hear any answer. Will there be transportation to those centers, or will that be something that the parents or guardians would have to deal with?
So no, there is not transportation. So their parent, guardian, or any caregiver, neighbor, whomever who can safely. We're also looking at possibly supporting the crossing guards being available at these sites as well. So unfortunately, the transportation is part of the school busing, and so that's not available to us, and we're not in a position to provide transportation.
Okay, thank you very much.
Thank you, Natasha. We have just 3 minutes left. Let's go quickly to one question each for a second round. First, Shara Arias of Telemundo.
Thank you, Mike. Armando, la pregunta es la siguiente, para abarcar el tema de los campamentos. ¿Qué va a hacer la ciudad? Si el tribunal decide que las personas se pueden quedar ahí, ¿cómo lo van a mantener seguro? Y si el tribunal decide que no se pueden quedar ahí y lo pueden remover, ¿qué planea la ciudad hacer? ¿Para dónde lo van a enviar? Si hay muchos albergues que no están permitiendo que lleguen nuevas personas debido al COVID-19.
Question is in regards to the camps. What's the city going to do if the courts decide that the campment can't remain? And what will the city be doing in order to keep them safe? And if the decision of the courts is to not remain with the camps, where will they be sent? Because there are shelters that are refusing people given the situation with COVID-19.
We will continue to try to place people and get people services that they need. I think we placed over almost 100 people in varying degrees of shelter and drug treatment and the like. We will continue to do that and work with the folks that are there. We'll see what the judge says. I don't want to speculate as to what the judge will or will not do. But again, if it's a federal judge, we will abide by what the federal judge tells us to do. We're law-abiding and take our direction from the court when we're directed, and we'll see how it turns out. I mean, it's a difficult situation to balance. You have the needs of the folks that we understand the housing needs in this country. We have the needs and desires of the people who live in both neighborhoods, one in North Philadelphia and one out on the Parkway. Not happy with the situation, and we're stuck in the middle trying to balance it all with very little resources. So we're doing our best, and hopefully we'll resolve it in an amicable way.
Nosotros vamos a continuar tratando de ubicarlos en lugares donde puedan obtener servicios. Nosotros ya hemos reubicado a más de 100 personas, les hemos dado cobijo y les hemos dado programas de tratamiento contra el uso de drogas. Vamos obviamente a esperar a ver qué es lo que decide el juez y vamos a cumplir con las disposiciones del gobierno federal o de los jueces federales y vamos a observar lo que nos digan. Por supuesto que vamos a ver qué es lo que suceda y si resulta ser que hay gente que necesita más ayuda, este es un programa de larga data. Vamos a ver si el campamento que está en el norte de Filadelfia y los que están en el Parkway pueden reubicarse en otro lugar. Nosotros estamos en el medio de todo esto, con recursos limitados, y estamos tratando de hacer lo mejor posible para resolverlo, de manera que vamos a ver qué es lo que pase y cumpliremos con ello.
Thank you, Armando and Shira. We have time for one last question back to Rudy Chinchilla of NBC 10.
Thank you. This one's quick. So I may have missed it, but what are the rules for diners themselves when they're going to restaurants? We've already heard the rules about workers, but I'm just curious about diners, what they have to adhere to for masks.
They need to be wearing a mask unless they're sitting at a table eating a meal. Simple as that.
Okay, so they have to walk in with a mask, and I'm guessing walk out with a mask.
Yes.
All right,
And,
thank you.
and tip.
Definitely. Thank you, guys.
And on that note, thank you all. This concludes today's briefing, and we will resume these